No?
Then this adolescent health academy वाला कौन है और
समीर
समीर
सर
भाई.
समीर भाई है. Okay. Welcome समीर भाई.
गुड इवनिंग मैडम.
Very good evening. शमी जी आप थोड़ा सा ये वेलकम डॉक्टर अजय सर.
Yeah, good evening, madam.
Yes, sir.
Very good evening. Very happy and excited to attend today's program.
Same here, sir. Same here.
Uh, Dr. Samir, good evening. Kalyani madam,
evening, sir.
Deepak sir, Shushma madam. And
Welcome, sir, and we are very much delighted to
Yes,
have you
sir.
with us today.
yeah. So you did not miss yesterday's match.
No, I didn't. Very thankful.
Yeah, I missed it because there was a bad weather here, so the signals were poor.
Oh,
But anyway, I
okay,
saw the
okay.
highlights.
Oh, it
You are, so far,
too
you are absolutely perfectly visible, sir, and audible as well. And we hope for the same throughout webinar.
Yeah.
So, शमी जी इनको बुला ले क्या दीपा को और जब कल्याण शमी जी do you have that Kalyani, can you call Dr. Prashant?
yes ma'am, I'll call.
And शमी जी पहले आप थोड़ा सा दीपा को बुला लें.
Yeah, yeah.
बाकी कौन रहेगा? यतीन भाई है. समीर भाई यतीन भाई को बुला सकते हैं आप.
मैडम अभी
थोड़ा
टाइम
सा
है,
एक बार
आराम
गो
से.
थ्रू करें.
Hey, 8:30 we are starting, no?
Yeah, it is just 5 minutes away.
Yeah,
So
we are at
Samir bhai, we can
8:23.
go through the slides. We can just check the slides.
समीर भाई आपके स्लाइड्स मेरे यहाँ सेव नहीं हो रहे हैं बिकॉज इट्स पासवर्ड प्रोटेक्टेड.
नहीं सेव हो जाएगा, उसको ओपन नहीं कर पाओगे, उसको जस्ट रीड ओनली करना पड़ेगा.
हाँ, रीड ओनली ऑप्शन नहीं दे रहा है. क्या हो रहा है? यूजुअली वी गेट दैट रीड ओनली ऑप्शन.
आपको पासवर्ड भेज देता हूं.
हाँ.
There is a request by our secretary, Dr. Rashmin, to just call him in the beginning because his
रश्मिन सर
birthday.
का क्या हुआ? नहीं आ पाएंगे.
No, his birthday. He wants to go and celebrate with his family.
Oh,
तो मैंने
It's
ग्रुप
his
में डाल दिया,
birthday.
ग्रुप में डाल दिया.
Yeah,
We've taken note of that. We'll first wish him.
yeah, definitely.
जी what's happening today? कोई भी ज्वाइन नहीं हो रहा है. अदरवाइज अब तक तो कार्य होते.
I'm calling Deepa, ma'am.
Deepa and Prema are doing.
They must have thought 9 o'clock because this is 8:30.
No, sir. It is always 8:30.
Yeah. And normally our programs at 9. So,
हाँ, पर एज के प्रोग्राम चालू हो जाते हैं 8:30 को.
okay.
ऐसा क्यों हो रहा है? नहीं आ रहा. समीर भाई, your slides are visible. प्रशांत का क्या हुआ?
Good evening.
कॉल नहीं उठाया
Deepa.
मैम, मैं करती हूँ फिर से ट्राई।
Good
हाँ जी,
evening, all of you.
वेरी गुड इवनिंग दीपा।
गुड इवनिंग मैम, गुड इवनिंग।
वेरी गुड इवनिंग।
Good evening, Dr. Yatin. Good evening, Dr.
Yes, good evening, good evening.
Tanushree Madam.
Very good evening, Dr. Yatin.
Yeah, good evening
Just now saw
all.
Kalyani Madam. Yeah, good evening, Dr. Kalyani.
Good
गुड
evening,
इवनिंग
Deepa.
सर, गुड इवनिंग।
हाँ दीपा, आप इनको बुला ले, प्रेमा को।
ओके मैम।
जी, थैंक यू।
Deepa Madam, we have not put the minutes of the welcome notes. You must mention minutes the speaker is allowed to talk. Maybe half a minute would be enough. I
सर
think.
डाला है, मिनट्स तो डाली है सर,
नहीं
दीपा
नहीं
ने डाली है।
मतलब each person is allotted how many minutes? That's it.
हाँ हाँ,
It's
वो
understood.
शायद
It's half a minute. It's half a
एग्जैक्टली।
minute or 1 minute, not more than that, because main content will follow. No?
और क्वेश्चन 1 या 2 मिनट हो सकती है। लेट योर द moderator join us. Welcome, Dr. Rashmin bhai.
Rashmin ji,
Good
happy
evening,
birthday.
Shukla
The
And
madam.
birthday boy
happy
has
birthday.
joined.
Many happy returns of the day.
The birthday boy has joined.
Yes,
Where
yes.
is your suit, boot, and all, and wallet,
And where is
and
the
the cake?
just, just finished, just finished. Thank you.
Yeah.
Uh,
Very happy birthday, Dr. Rashmin.
Yeah,
Thank
happy
you.
birthday, Rashmin.
Thank you, thank
Happy
you.
birthday, sir. Happy birthday, Dr. Ishmael.
Thank you, sir. Thank you.
Welcome, Dr. Prema.
हाँ,
Um,
गुड इवनिंग एवरीबॉडी। गुड
very good
इवनिंग
evening.
दीपा मैडम।
Good evening,
Very good
Dr.
evening.
Prema.
Very good evening, Prema जी। डॉक्टर दीपा, आप लोगों के पास ये है क्या बैकअप?
नो मैम, प्रशांत ओनली।
Prashant has not yet joined. I told him. No, he shared either in the group or with email or something.
Drive, yeah, Google Drive, it is there in the group.
Google Drive. He shared in Google Drive. Dr. Cmic, please share with Deepa or Prema. किसके पास तो होना चाहिए. If something happens, they can always go ahead.
प्रशांत सर इज जॉइनिंग मैम, जस्ट कॉल्ड हिम।
अच्छा अच्छा अच्छा। डॉक्टर Cmic, आपके पास है क्या उनका पीपीटी? एक बैकअप रख के प्लीज।
Yes.
Prashant is joining.
Yeah, Prashant is joined.
Dr. Cmic,
Welcome,
you are on the
moderator.
recording. Who's doing the recording?
Welcome today's moderator.
It's on YouTube, sir.
Recording, right?
Yeah. There's a live streaming.
Yeah,
We'll
thank
get a
you.
recording of that.
Thank you.
First, we will have talk, right? Then panel.
Prashant, can you please share once again to either in the group or to Deepa, because there
Sure.
should be some kind of a backup. And
Sure.
welcome, Dr. Banga sir. And I request
Namaste.
Dr.
Yes.
Deepak ji to please start the proceedings. It is exactly 8:30.
Good evening, all. Good evening, all the esteemed members of IAP, AHA, and CMIC, and welcome to all to this intra-specialty webinar series. And today's series is on understanding the digital maze in support to the healthy adolescent development. As all of us very aware of the fact that in today's digital era, adolescents are not just growing up, but they are in a kind of a sea of digital ecosystem that influence their attention, their emotion, their relationship, and their self-image. And there is a very thin line between good effect of this and the bad effect of this. And when they slide over this, it is sometimes becomes very difficult for parents, for pediatricians, especially for parents to understand this. So to clear this, we have a esteemed faculty today here, and this is a very good initiative by the Cmic chairperson of AHA, Dr. Sushma Desai, and I also call her to say a few words and welcome all of you. Dr. Sushma Desai.
So, very good evening to the distinguished guest faculties, particularly from the Cmic chapter. My own family, AHA family, Dr. Cmic ji, Dr. Banga sir, Dr. Samir bhai, Prashant, and Deepa, and Prema ji, and all, Dr. Chitra Kulkarni, I can say, and Dr. Geeta Bansal, all of you. I extend my hearty welcome to all of you to the fourth of this webinar series. And it is one of the most, tough, I think, eagerly awaited webinar, because we all know as an digital health, probably we have taken it as a most important integral part of adolescent health horizon. We have now incorporated the history taking regarding the environmental health as well as the digital health in our psychosocial screening. We all know the adolescent has a kind of always been a period of exploration, identity formation, so many rapid changes happening in their life. But as Dr. Deepak very rightly pointed out, they are growing up now in this today's era in an environment where the digital world is no longer separate from the real life. It is so much interwoven into their education, their friendships, their entertainment, and the communication, and even their emotional well-being. So technology has definitely opened unprecedented opportunity for the learning, creativity, and connectivity. But it's very important to accept now that it has also created a complex digital maze filled with challenges such as excessive screen time, cyberbullying, misinformation, online exploitation, gaming, and unhealthy social comparison. We all know the growing impact of artificial intelligence on the young minds of our adolescents and youth. The question before us actually is not whether technology is good or bad, because it's we deny or accept it's an integral part of all of our life. Rather, it is how we can empower adolescents to navigate this digital landscape safely, responsibility, with the and confidently. As pediatrician and adolescent health professional friends, we must equip ourselves not only with the clinical knowledge but also with the skills to guide families, advocate for digital well-being, and foster resilience among the young people. We are extremely fortunate to have the most eminent dignitaries as the speakers and faculties with us, which includes Dr. Samir bhai. He's so very well known. Dr. Ajay Kumar sir, who is the chairperson of Cmic chapter. Dr. Yatin bhai, a very well-known name in the digital media and its medical aspects. Dr. Cmic Ghosh, our own HSD, and Dr. Kalyani Patra, who is so very well versed with the digital media and its uses and hazards which are found in the adolescents. We have a very, very dynamic moderator, Dr. Prashant Karya, a very well-known name for the digital media and the talks related to that. So friends, without wasting much time, let us embark on the mission. Let us start our learning. And I wish happy learning, and let's have a wonderful academic evening today. Thank you so much. I hand over to today's MOCs, Dr. Deepa and Dr. Prema, for the further process. Dr. Deepa,
Good evening, all.
unmute kariye.
Yeah. Am I audible, ma'am?
Yes.
Yes.
Good evening, one and all. I would now like to invite the chairperson of CMIC chapter, Dr. Ajay Kumar, for his comments and valuable address. Over to
Thank
you.
you very much, dear dignitaries, members, and the pediatrician doctors who are participating today. It's my indeed a great pleasure and a wonderful idea of having a interspecialty chapter webinar series in Indian Academy of Pediatrics between two sub-chapters or individual chapters which may not look related, but today our chairperson of the Adolescent Health Academy, Dr. Shushma Desai Madam, has taken an initiative and asked us, that is the Computer and Medical Informatics chapter, to participate and interact and tell us about what's happening in the today's adolescent world, especially in the digital world. And I'm very grateful to my own subchapter members. Our past president, Dr. Samir Shah, was going to give a solo talk by him. And then we have got our secretary, Dr. Rashmin Cecil, whom I want to wish him a birthday. His birthday today. In spite of that, he has come. Happy birthday to you, Dr. Rashmin Cecil. And we have got a former chairperson also, a brilliant academician and also a digital expert, Dr. Yatin Mehta. And then we have our own members from our chapter. And this is going to be a very exciting and very informative and very broad perspective program for all of us. And I'm sure we will benefit from this. And I'm very, very happy that Dr. Samir and Dr. Prashant Karia, who are doing wonderful job in both the sections, both in digital world and also in adolescent world. And today you will have a feast of the academic feast from all of us. And let's start. And once again, thank Adolescent Academy and the president, the chairperson and the secretary and other members of the chapter. And I also thank our own chapter members for coming out with this wonderful program of interspecialty webinar. Thank you very much.
Thank you, Ajay sir, for those words of appreciation. And now I would like to invite the secretary of CMIC chapter, Dr. Rashmin Cecil. Happy birthday to you, sir.
Dr. Rashmin, I think he's busy in cake cutting. Are you, Dr. Rashmin, please?
Dr. Rashmin, are you there, sir?
Deepa, we will take his comments when he joins.
Yeah.
Okay, okay. Over to Dr. Prema for the further proceedings.
Thank you, one and all. It's really wonderful to be here. So we have our next talk by none other than Dr. Samir Shah, who was the past president of president of the CMIC chapter, and he's a well-known pediatrician who has got a lot of credits to his feathers to his cap, because we all know him not only as a pediatrician and also an adolescent practitioner and an AI enthusiast. He is a lot of interest in adolescent medicine with also in computer and medical informatics and artificial intelligence, including vaccinology and prevention of child abuse and neglect. So with the key things, like currently, like he is the coordinator of the subgroup on artificial intelligence in 2026, and also the course convener for the IEP ICP course on artificial intelligence. And he is the lead SAHM, that is the during the International Adolescent Health Week. And he was a member of the publication editorial board of the International Society of Health Medicine, that is SAHM. So being the past president of the CMIC chapter, and also he has held various other posts. So without wasting much time, I would like to invite Dr. Samir Shah to give his talk. And I was also told to remind that it is for 20 minutes and to keep the clock ticking. So over to you, sir.
So, dear friends, very good evening, and I hope my voice is audible, right?
Yes, yes, it is.
So, today the topic that is the really a burning topic, because this era is of the artificial intelligence, and now everything what we connect always connected with the artificial intelligence, and same is for the mental health of the adolescent. Today's talk is very important because it will be now not only about the adolescent, but it is also connected somewhat about the adults also, and all the human on the earth, which is related with the artificial intelligence, connected with the, and this is the era which is coming so fast and so boomed that ultimately giving us a no chance to understand it. So let's try to understand as maximum as possible how it affects the mental health of the adolescent in this era. So this is my disclaimer. I am not a technological expert, but of course the techno enthusiastic pediatrician. And this the presentation is combination of my experience and research. And this is only and only for the sharing of the knowledge. No commercial aspect is there. Not supporting any particular company and brand, but happy to add more points if the experts have more input over and above what I am explaining. This is the agenda of the next 20 minutes, what that I am going to present. So let's see what is the epidemiological landscape that actually having the mental burden in India. In context of that, what we see is the actually 1 in 5 Indian children experiences significant mental health concern, and at the same time we have a really lack of the child psychiatrists who are really practicing as a child psychiatrist in case presence of the 450 million children under the age of the 18 in India. So almost 80% deficiency in the children with mental health conditions that receive a formal treatment. And that's why there is a diagnostic delay from starting from 9 to 12 months, even all the routine procedures what we follow. At the same time, even though the technology is going up to the end of our small villages, but still the condition is not so that it will be taking care of all the children or the adolescent who is presented into that village area because of the lack of their own device and the networking. As per the study of the RU There AI by the Youth Ki Awaaz and YLSS study, it shows that almost the 88% of the Indian school children utilizing as a GPT, ChatGPT, or other artificial intelligence tool as a primary coping mechanism, especially between age of 13 to 18. 70% of the adolescents who tried AI companion app, they are usually using them monthly, and 50% become the regular user then after. 1 in 8 adolescents now consult the AI chatbot for the mental health advice rather than the parents or the human professionals. And again, AI serves as a private, anonymous shield to youth who giving good cultural and family judgment historically associated with this geriatric care. So it will give a proper shield to that, and that's why they are making it some more companionship rather than seeking the help from the parents and the psychiatrist. But why it is happening? Because it's not everything is the dark or the red. It is the very thing, many beneficial applications used by the artificial intelligence that empowering the adolescent. Like the personalized learning is very, very easy now. Like the AI tutors adapt the individual pacing and learning style and significantly improve the concept and clarity. At the same time, it's really academically support very high, like the summarizing and translation in the vernacular language, quick explanation, and at the same time, it will be equally available with the rural and the urban students. Creativity and innovation is its peak because of the help of the artificial intelligence, and that crafting such a innovative ideas that will give us such a excellent outcome that what we are seeing now. At the same time, if we take a proper systematic channelized thing, it's giving a very excellent mental support by the anonymous chatbot, giving a safe space for the emotional expression and acting as a bridge between the highly hesitant who are going not want to go to the psychiatrist or any other support. And at the same time, digital skill development increase the productivity and research methodology that will be clearly driven by the artificial intelligence. So bottom line is it will be when regulated, AI democratize the learning and unlock the adolescent potential a vast majority time. But at the same time, if it is not regulated, it emerging a extraordinary risk, starting from the critical thinking reduction, and because of that, they have to giving the degraded independent and problem-solving ability. Misuse in the academic curriculum like plagiarism and just copy pasting the assignment without understanding and learning that lead to the severe problem during the exam. At the same time, so many misinterpretation and hallucination that will be driven by the artificial intelligence, improper unstructured use that lead to the improper answering by the artificial intelligence, and that lead to the factual verification and lacking in the clinical judgment that lead to more and more hazard rather than the it will be giving a productive outcome. At the same time, emotional and social impact is so high that now virtual companionship is coming so more and more rather than the less bonding of human interaction and peer bonding. Ethical safety and risk is always and always increasing day by day because of the exposure of deep fact, cyber manipulation, privacy breach, and identity misuse. As the 24/7 availability, artificial intelligence driven overuse become the perfect friend what our children are thinking and thought about. And that's why they can also remain awake a late night, never critically and entirely non-judgmental. And because of this 24/7 availability, it lead to the more and more psychological and digital dependency. At the same time, it also filling the loneliness gap, and AI serves as an immediate, frictionless emotional crutch. It never says no to the emotion. It always and always giving the soothing effect in the mental stress and free period. And it ultimately gives unconditional validation. And this is the danger because if there is a no friction, child is not able to understand what the resilience is, what the problem that can face and human interaction, and because of that, they having a more and more digital dependency. And so hidden the risk will be that AI feel like a perfect friend, but it replaces the real world connection, reinforce the unhealthy pattern, and delay in help of the real people, and that make a more troublesome outcome in end. But at the same time, if we check if it is properly maintained and managed, it having an excellent clinical promises. Like early screening and diagnostic, like the START app, that is the screening tool for the autism risk using the technology, it will be the almost 86% accurately identifying the neurodevelopmental disorder. Canva DX, again a one excellent tool that is actually a clear diagnostic tool that analyzing the parent submitted home video and using the AI-enabled rapid analysis and give the diagnostic outcome of the autism. And that is really powered by computer vision and machine learning. And with such type diagnostic pipelining tools, the ultimately cut the diagnostic waiting list what initially mentioned about 9 to 12 months into the few days only. And because of that, early intervention can be easily possible. There are many hardwares and softwares are now available that it will be help us to prescribe a technology and variable outcome, and that will help keep children having a really mental problem. Like the Endeavor RX, it is a first FDA authorized game-based digital therapeutic device that prescribe and improve adult ADHD outcome. No doubt it is not at presently available in India. At the same time, embodied Moxie, a robot that apply the behavioral analytics and cognitive behavioral therapy to teach emotional regulation in the neurodevelopmental children. At the same time, augmented reality brain power system using the smart glasses to gamify and improve the eye contact of the children with the autistic spectrum disorder. That is an excellent outcome based the augmented reality. At the same time, Mid bioessence passively monitor a physiological stress in a child having some panicky attack, and it fragments the lavender perfume, and that will reduce the stress level, and that's why they can control and manage the same. So this type of this soothing support can be possible because of the such type of the innovative diagnostic tool that help the artificial intelligence. There are few first line and triad and skill building coaches and assessment tools are that available with the, having a conversational artificial intelligence like Visa and Voebot that will really give a structured CBT exercise and highly effective for stigma sensitive youth. At the same time, Coilin having a purpose-built Indian context featuring of the mood tracking, crisis detection, and weekly parent insights report can be possible. Never Alone AI aims daily WhatsApp chatbot available by 24 by 7, giving the prevention of the preventive student suicide. At the same time, Udly and 6-second EQ neural net really giving a good coaching effect, like they can reduce the social public speaking anxiety. At the same time, it will be also generate a personalized emotional intelligent assessment. So by 24 by 7 availability, easy accessibility and scalability, and reduced stigma and building a skill and EQ, it will be the properly utilized in observed way. AI is highly effective in management of the neurodevelopmental and mental stress level related problems. There are the clinical decision support system that is also available for pediatricians, and ultimately all these support systems combinedly reducing the burden of making the all the long files and making it continuously lengthy clerical work. This can be directly assisted by the co-pilots and directly scribing what is the discussion that happening between the doctor, parents, and the student, children, and that will directly convert into the SOP note, and that will reduce the burden of effectively communication will be improved, and that burnout will effectively go for the excellent clinical assessment and management for the clinician because of the reduction the burden of their clerical work. But at the same time, we have to understand there are the multiple pitfalls, and that lead to the artificial intelligence addiction, and that lead to real world consequences like almost 70 to 24% of the dependency rate of the AI companion observed among the youth. Aliza effect, that is the some specific effect like the psychological phenomenon where human from intense misplaced emotional attachment which the machine such like that they are understanding that all the machine is saying that is by human, not by the machine, and that Aliza effect lead to more and more dependency on that devices. At the same time, there are these very effective filters are there, but even though there is documented encountering the eating disorder, risky behavioral and self-harm, that will be the effect of the improperly utilized or the underly utilized safety tool, and that ultimately lead to the artificial intelligence related mistakes in clinical diagnosis and management. There are tragic outcomes now we all know that including the legal cases, teen suicide, and that directly linked to the emotional dependence and unregulated AI companion platform like AI. So AI is not the substitute. That what we have to understand, human connection and control is must. Now, what we understand that there is so much disruption of the adolescent brain development that ultimately lead to the real growth happen in real relationship that lost because of the forced closing of relationship growth. Because AI, artificial intelligence chatbot, never say no. It always soothing and continuously affecting the interpersonal conflict. And that repair and building resilience will never affected and never gained by these children. And that will be that conflict and repair and resilience is will be the really impaired because of the continuously highly use of artificial intelligence. It atrophies the distress tolerance because it provides instant unconditional validation and child's natural capacity to tolerate the real world discomfort significantly reduced because of such type of the AI companion tools. We all know Harlow's monkey analogy in wired mother could not replace the authentic maternal care. An AI companion cannot provide a genuine friction-filled human contact necessary for the healthy emotional maturation. And ultimately, all these keep at the cost of the neurodevelopmental problem in the adolescent at that early age. There is a many physical and some pathological problems like late night use of the 24/7 availability of the artificial intelligence that lead to the sleep disturbances and almost 47% of the engage with the artificial curated platform into the late night almost 4 or more times a week. And this ultimately late night exposure significantly alter the sleep architecture and that lead to the mental well-being effect and heightens the psychological stress. And that ultimately lead to the more and more sleepless night and stress-free life of our children. No, for that we have to recommending the parent that no screen 1 hour before the sleep and that rule we have to manage to that understanding that better sleep, better mood and better future. There are few ethical concerns and algorithm bias that also we have to take care while we are utilizing the artificial intelligence for the mental health. Like the deceptive empathy means AI chatbots systematically violate the mental health ethics by faking that human connection that I am deeply concerned and care about you. Actually, it is just a mechanism not concerning any human things. At the same time, cultural disconnect because of the comprehensive Indian family dynamic, collectivist and expectation and local emotional ideas is totally failed when utilizing the Western context and connected artificial tool that having a no idea about what the Indian culture is and what the Indian culture requires. AI psychosis are now newly observed clinical phenomena where the chatbot mirror a valuable user's delusion and actively amplifying and co-creating psychotic symptoms rather than improving the psychosis. So if AI is not properly utilized, it lead to the harm than anything do good. But what we discussed till now is the uncontrolled use of the artificial intelligence. But if we integrate in a proper systematic levelized manner, like a Telemanas model, this framework will be the integrating a public health development in such a way that it having a two slab approach. That is the first is the AI layer having a safely handle the low intensity and high volume tasks like taking support, symptom check, language translation, and basic psychoeducation. And then that will be transferred to the human clinical psychology and that the human psychiatrist and pediatrician that retain all the document that is collected by A and giving ultimately formal diagnosis, complex psychological care, crisis intervention and give a clinical judgment that will be sometimes oversight by the artificial intelligence. And such type of the scalability help by the 24/7 helpline, almost 20 plus languages that is available across the India. So such scalability can be possible. So artificial intelligence plus human working in hand to hand, giving a strong support system to care a child and of course all the human aspects. Few screening protocol that what we have to follow being a pediatrician. If we deal with a preteen between between 8 to 12, our target is to identify the early sign of the emotional dependence and behavioral dysregulation. For such thing, we have to directly question to the parent that how much time does your child spend interacting with the AI or chatbot daily. Thus, the child becomes the highly irritable, aggressive, or upset when the access to the AI is restricted. If we ask just two questions, this will be giving an early red flag that more than 2 hours of the daily use of combined with a severe emotional distress and aggression upon removal of the device indicate a really escalating the behavioral addiction, and we have escalating the behavioral management and support also. Now we have to understand that there are the few other things that what we give when we are considering the uh, age group between 13 to 17. Here, our requirement is the private clinical interview rather than the teenagers actively doing dependency. Here, we have to give a proper private interview and directly asking to teenager, do you hide your AI use for the, your parents and friends? Do you feel that your AI companion understand you better than your real friend? And the clinical reflex of answering yes to the preferring the AI, understanding over the human connection, extreme risk to the profound social isolation and emotional dependency. And for that, proper action and support is important. So early identification can be utilized by a simple diagnostic clinical screening tool that what we can implement in our day-to-day clinical practice, and such type of a screening tool can be possible. Now, few pediatricians digital toolkit that for the monitoring, that including the first line support like the Visa and robot that will recommended for the clinically validated tool as a safe step for the hesitating and stigma
Sorry to
sensitive adolescent.
interrupt, Dr. Samir Shah. Just 2 more minutes is left.
Sure,
It's 20
definitely.
minutes.
Yeah, I will
Thank you.
complete. Then second will be the behavioral and screening time monitoring tool that we can provide to the parents like the Google Family Link, Apple Screen Time, and Custodio. Few AI-specific parental control tools like the Mobisip, Bart, and NetNanny also now available that empower the parents to protect the children, prevent the digital over-dependency, and ultimately giving a good boundary to use of the artificial intelligence as well as the digital media utilization. For the digital literacy, we having a very effectively now ChatGPT, Canva available that will really create excellent posters, parents handouts, and clinical site that will really clearly explain what the problematic internet use, signs to watch for, digital risk, healthy habit, and when to seek help. We can have a clear digital literacy media platform is now available. That is the age-based review of the application, digital citizenship, misinformation and resource for the parents and education can be given with the use of the artificial intelligence. At the same time, some common sense media currently expecting the recommended that no under 18 should AI companion due to the unacceptable species. So we have to educate the parents that this clinical warning they have to maintain and watch for. So in conclusion, and key takeaway, the dual reality is that AI is massively accelerated diagnosis and democratized the learning, but carries a severe addiction rate. Screening at every visit is the rule for the pediatrician because AI dependency questions must become a standard part of our routine workflow about how much time you spend really irritable when not you are able to get, or do you feel it's a more companion rather than your parent? And ultimately step up care, starting from the early identification, then targeted intervention and intensive care with a human-based approach. That what we have to give to the understanding that mental health, why the help of the AI will be always beneficial. But if it not having a human touch or human healing, it will become problematic. So AI is transforming the pediatric mental health care, and our wisdom will guide its impact. Thank you. Thank you for the consult. Over to Amos.
Thank you, Dr. Samishra, sir, for this wonderful presentation. I felt like taking screenshot of every slide of yours. It's totally a new topic. And it is.
Thank you.
Now, moving right into the core clinical segment of the evening, our grand panel discussion titled Navigating the Digital Maze Around the Adolescence, Challenges and Solutions. It's my absolute privilege to introduce the stellar lineup of faculties for this session, all in one go. Our moderator, Dr. Prashant Karya, needs no introduction. He's from Surat. He's Associate Professor and Unit Head at Kiran Medical College and founder of Yuva Mitra Teen Clinic. He was the EB member of Central IAP during 24-25.
Make it full screen, please.
Our first panelist is Dr. Ajay Kumar from Hyderabad. Sir is a senior practicing pediatrician, National Board Teaching Faculty, a chairperson of Computer and Medical Informatics chapter of IAP, and is well known for his financial knowledge.
Thank you.
Our second panelist is Dr. Yatin Mehta from Vadodara. Sir is the director at Lotus Hospital for Newborn and Children, and he was a past national chairman of CMIC chapter of IAP.
Thank you.
Our third panelist is none other than Dr. Cmic from Kolkata, is the founder director of Stan's Viral Clinic and currently is the secretary of Central AHA. And the last panelist is Dr. Kalyani Patra from Navy Mumbai. She's the adolescent consultant at MGM New Bombay Hospital, and she's the chairperson of Navy Mumbai AHA. So warm welcome to all of you. I now invite our moderator, Dr. Prashant, and our distinguished panel members to take over the virtual flow. Please note the total duration of panel discussion will be 45 minutes. And to help you keep up with time, I'll give you a gentle reminder at 40 minutes and then at 43 minutes. Over to you, Dr. Prashant. The floor is yours.
Yeah, thank you so much. And I just hope that my screen is visible and a full screen. Thank you, Deepa, for introducing us, and my work is done. So we will be very crisp and to the point. It's already 9:10, so we'll be finishing on time. But today's learning objectives are simple. As adolescent pediatricians, we know the importance of HEADS assessment in digital health, recognizing the early signs of digital addiction and social media boundaries, identifying online sexual abuse and exploitation. We will learn about the cyber safety measures, also how to counsel adolescents and parents effectively, and know when referral is necessary. And most important thing will be a legal and ethical responsibility will be there. So if we start the topic, which is today's biggest adolescent threat, if I ask this question, then the answer will be the screen addiction, the social media pressure, the cyberbullying, the gaming and internet addiction, and everything will be there. Just give me, is my screen fully visible?
Yes, Prashant.
Fine. Okay. So HEADS, we all know, so I'm not going into the detail, but now in activities in today's era, when AHA and CMIC are combined, we have to ask about the mobile screen and the AI use. So coming directly to the case, which is there, a 14-year-old boy who is brought to the clinic with complaints of daily headaches after school, burning and dry eyes, blurred vision after prolonged screen use, neck and shoulder pain, poor posture, reduced outdoor play, sleeps late after using in phone in bed, and spends approximately 8 to 10 hours per day on screens. It can be online classes, gaming, social media, YouTube, anything. And his parents are worried that he may need spectacles. May I ask the audience, what is the diagnosis you think in this case, so that we can come to know that yes, everybody is there with us? Any one or two things? Yeah, okay. Shubha Badami ma'am says problematic use, PMU. Okay. Anything else? And the symptoms are suggestive of which syndrome? PIU, internet addiction, PIU, internet addiction. Perfectly said. And this syndrome symptoms, which we have said, are suggestive of a computer vision syndrome. So may I ask to our first panelist, Dr. Cmic Ghosh, what is this computer vision syndrome and how common it is among adolescents, and what are the common signs and symptoms of it?
Thank you, Prashant. The human eye is a marvelous organ. It remains awake. Supposing you have a lifespan, average lifespan of around 75 years, it manages to remain awake and see things for a human being for nearly 35 to 40 years out of those 75 years. But it also needs some rest. And this rest is in the form of sleep and in the form of blinking. Now, obviously, whenever you are on the screen for such long periods of time, your sleep is getting compromised. The blinking, which takes place about 15 to 20 times in a minute, gets reduced to around 3 to 4 times because you're staring at the screen for longer periods. So the lubrication of your eye is reduced, leading to dry eyes. It leads to burning in the eyes, blurred vision, as well as a headache. So it is extremely common. Anything, more than 2 to 4 hours of usage, it causes nearly 50 to 90% of adolescents who are regularly using the screen more than 2 to 4 hours daily. They can have all these symptoms, which I just now mentioned. And the most important thing that we want to pass on is that other than the eye strain, the headache, the ergonomic issues like having neck and shoulder pain and having a difficulty in concentration, all of this is preventable. The screen is an inevitable part of our daily life now, but if we can follow a simple 20-20-20 rule, that is, closing your eyes every 20 minutes for 20 seconds and then looking as far as 20 feet and then concentrating back on the screens. If you have proper ergonomics, your posture is right, you're in a well-lighted room, if you're blinking frequently to allow for lubrication, and if you can limit your unnecessary screen time, which is away from education or probably whatever commerce you're conducting, you can prevent the computer vision syndrome.
Yeah, perfectly said. So when you said this tips, there are few advices which should every pediatrician give during a routine consultation to a parents that they should follow to prevent this type of CVS. One of that you already said. Kalyani, can you throw some more light? What are the other advice we should?
Yes. Very importantly, because many times we may not come across a teen who is coming with symptoms. So we can make it as a proactive asking them about this symptom, because teenager may feel that this is how the screen feels. That's why my eye is behaving like that. So what we need to tell them is 6 essential screen hygiene tips, as very well illustrated, said by Dr. Cmic. The 20-20-20 rule comes the first thing. Then we need to monitor the screen time, make them screen smart. So recreation time should not be more than 2 hours. Also, there should be breaks. That is very important. Every 20-30 minutes there should be breaks. Good ergonomics is something which is essential. In that case, you need to have the screen around 1 arm distance, that is around 50 to 70 centimeter distance from you. The screen should be ideally below your eye level. You should have good posture with a back support to avoid neck and back pain, and stretching should be done every 30 to 60 minutes. And blinking, already Dr. Cmic said good They should blink often. Also, there should be good lighting when you are watching a screen. You should not watch it in dark light. There should be reduction of the glare in the screen settings. There should be increase of font size so that it doesn't become difficult for you to read and you lean forward for reading. Protecting sleep becomes very essential when you are using screen for a lot of time. So no screens 1 hour before you go to bed. Physical activity outdoors actually reduces the stress and strain on the eyes, so that should be encouraged. And importantly, we should always know what are the signs where we need to refer when there are persistent symptoms. There is persistent headache, there is development of squint or a suspected refractive error. A pediatrician needs to refer.
Yeah, so perfectly said. So in a nutshell, if I say 20, 20, 20, you said, I'll add one more 20 is stretching 20 minutes.
Yes.
That can be a Pomodoro
Yeah.
technique.
20,
And blinking
20,
can
20.
we say 20 times blink after your 20 minutes. So 5 20s can be there, so which can be helpful. So this is well briefly said by our panelists, the first case. The second case is a simple case. Again, I'm saying this is a simple case that this is a perfect student who has suddenly changed. We are dealing with a pre-teen, that is an 11-year-old boy who was actually an academic topper, but suddenly having a poor grades. He sleeps at 3 a.m. He always tired, locks himself into the bedroom, uses headphone continuously. Parents think he's preparing for the JEE. Now the thing is, students start preparing from the 5th, 6th standard for the JEE, and the pressure on the student is such. Later, parents found that he was playing a multiplayer games online. Now, when the students are playing this type of games, they usually hide these things from the parents. And again, this is a gaming addiction, but they do have a fear of punishment. They do have a fear of criticism. They are actually developing independence at present. They like to be remain online and get the dopamine kicks and remain in contact with the virtual friends. And sometimes they use this as a escaping mechanism for the stress. And actually they want to spend a small time, but then they spend much time and they feel guilty. So they hide these things from the parents, and then the common academic backwardness which is there is happening. So over here, I'll just like to ask Dr. Yatin Mehta that when does this gaming become a gaming disorder? And do we have any screening tools which can be used?
Yeah. Good evening, all. Well, we all have realized that practically each and every teenager or adolescent, they manage to play game. But we must understand all those who are playing heavily, they are not suffering from gaming disorder. And we can very easily differentiate whether they are having a gaming disorder or whether they are just a heavy gamer. The heavy gamer, they enjoy gaming, whereas the one who are having gaming disorder, they are compelled to game. The heavy gamer or normal gaming person, they can stop when needed, whereas the one with gaming disorder, they cannot stop. The normal teenager with gaming, they can maintain grades, whereas this scholastic decline. The former, they will sleep normally, whereas with a gaming disorder, they'll have sleep deprivation. There'll be healthy friendship with a normal teenager, whereas here with a gaming disorder, there'll be social withdrawal. For a normal teenager, gaming is a hobby, whereas for a gaming disorder, the gaming dominates their life. International classification of disease 11, they have given a diagnostic criteria that there are 5 criteria. First is impaired control over gaming, so that the adolescent is unable to limit gaming time, unable to stop playing when intended, unable to reduce gaming despite repeated attempts. Second is gaming takes priority over other activities. For them, it is more important than school, sports, sleep, meals, friends, family, personal hygiene. Like, they will miss the exam or miss going to school if they are having some kind of a gaming tournament and everything. Third is continued gaming despite negative consequences in form of falling grades, family conflict, sleep deprivation, depression, poor health, vision problem, loss of friendship. Fourth, significant functional impairment in form of academic performance in family relationships, social functioning, emotional well-being, and physical health. And fifth, usually this kind of a symptom or the duration should be more than 12 months, but 12 months or more. But if all other symptoms are there and they are severe, then even with a shorter duration, we can consider it as a gaming disorder. Now, there are various screening tools available. Like, one is Internet Gaming Disorder Scale, Internet Gaming Disorder Test, Problematic Online Gaming Questionnaire. There are many which are based on DSM-5. There are many which are based on ICD-11. The first three, which is mentioned here, are more for research purpose or for institute, but for busy pediatricians like us, GDT, that is gaming disorder test, is fairly good because you need to ask only 4 questions. I mean, the questionnaire is given to the teenager, and they have to write down the answer. I mean, they have to take it, and the score is minimum 4, maximum 20. Within a minute, you will be able to tell, whether he is suffering from gaming disorder or not.
Yeah, so perfectly said, Jatin bhai, and this tools can be very much useful. Over here, the question which came in our mind is that the gaming, which we said is gives a kick and dopamine reward is there. So, Dr. Ajay, what should every pediatrician know about this dopamine and gaming?
Yeah, this is the earliest thing which was noticed that screen time or social media or gaming for that matter has got an ability to release or activate the centers in the brain which releases dopamine. And this is what we all know that what dopamine does. Basically, dopamine gives like a sort of achievement, excitement, pleasure, or sort of a self-satisfaction it will give us. So these adolescents get hooked to the screen continuously. So the gaming feels that they are going to get some reward. So they keep get instant points or rather they get batches or victories. So a sense of achievement will be there. And because this games are devised by the creators to give them an unpredictable reward, so they keep on playing, the brain keep on asking for more and more of this excitement or achievement or pleasure from this release of dopamine in the loop. So brain learns to play, reward, and repeat. That's what happens, and that's why they get hooked to the gaming pattern. So excessive gaming, already Dr. Yatin has mentioned that what are the reasons between the disorder and also the healthy gaming. A poor concentration, irritability when they are stopped or when they are asked not to play the games. They don't have interest in any other activities other than gaming, and they have a sleep disturbances whole night. They are awake and daytime they feel sleepy. Academics decline and they continue to game despite all these problems are there. So the pediatrician try to see that how long they play, how long they are on the screen playing games, and they should also see if there is any loss of control, assess the impact rather than criticizing. Balanced view is very important. We cannot say the child not to play the games because it's accessible nowadays. It's also accessible round the clock, 24 hours a day, as some of the panelists have also mentioned. So basically, probably you can say to encourage healthy habits or play physical games. And families should be guided to set sort of limits and focus on the connection, not the conflict. So there should be a healthy relationship between the parents, the family members, and the friends. So the key message should go to them that we must try to understand the brain and understand the behavior. The dopamine could be the major reason which is making all of these kids addicted to that. So the healthy mind and healthy screen habits and leads to a better future in life is what we have to pass on the message to the parents and to the child. Difficult, I know, but that is what we have to insist.
Yes, perfectly said. And as we all know, this adolescence wants rewards, and this dopamines are giving kicks. So we can just teach them the healthy ways to get the dopamine kicks. That's why we say exercise at least 20 minutes a day minimum to 45 minutes will give release endorphin. If we give them small goals, and if they achieve it, they get dopamine kicks. If they like some hobbies like singing, dancing, anything, that also gives them a dopamine. A sunlight, a meditation, or a connection with a real friends, or a creative flows will also give a dopamine kicks. And most important for them will be a good sleep. We say at a stretch sleep of 8 hours will be beneficial in releasing the growth hormones as well as decreasing the release of the stress hormones. So that should also be taught to them. So saying this, should parents ban games completely? What do you think, Dr. Shamik?
Thank you, Prashant. The first and foremost thing as parents we must realize is the moment we ask a child who at this age does not have the prefrontal cortex, has a hyperactive limbic system which is forcing the child to act on his impulses, just telling the child not to do something might just make it a forbidden fruit for which they may become even more curious. So, the first and foremost and important thing is this understanding for every parent. The second thing as a parent, which we must realize, is that we need to be good role models. All through our rearing of our child, whether it is our mother tongue, whether it is our cultural habit, whether it is our lifestyle, unless we demonstrate them through actual actions, which will always speak louder than words, and unless and until we are good role models, our children will never follow us. What is also important as a parent is to realize that we need to increase human engagement. All of this is happening because of lack of human engagement. There should be good human engagement within the family, wherein there should be warmth, affection, and clear cut family time. There should be good human engagement with the peers of this child. It can be supervised, encourage friendships which are open. And of course, as a parent, we need to insist to keep them away from the screen is to encourage outdoor physical activities, which should tantamount to around 60 minutes per day, at least 3 out of 7 days of the week. As far as the role of the schools is concerned, the schools can promote digital well-being by teaching very responsible screen behavior, teaching responsible digital literacy, as well as telling them about what is responsible gaming. They have to take classes and also be vigilant about early warning signs and offer counseling wherever it is needed. So, to summarize, increase the human engagement of the child rather than banning it completely. And for that, a collaborative approach involving parents, schools, and the healthcare professionals will be the most effective way to prevent problematic gaming.
Yeah, so perfectly said. And Dr. Shamik, as we all know, nowadays the students are actually playing the gaming Olympics. I mean, esports is now a medal event in the Asian Games, in which again you get recognition, a competitive sports, a teamwork, everything is there. Even they are earning the money out of this. And everybody wants to be a professional gamer or a YouTuber. We'll be coming to that in later. But what do we want to teach them is while you're playing this, you should have a balance. That is the most important thing. And few of the children are falling for the gaming betting. Because of that, they are having a physical disadvantages as well as the financial disadvantages, along with the isolation and the addiction, which should not be there. All these side effects of a gaming hazards, may it be a physical health issues or a reduced real world social connections, academic decline, sleep disturbance, hyperarousal and aggression things, addiction, neglect of responsibility, and time distortion is always been there. So any child with gaming addiction may be managed perfectly when we talk about this type of a gaming addiction, and especially some medication has to be given to these children. So Kalyani, can you just throw in brief something about the management and the medications?
Yes, as we discussed, prevention is also a teamwork. The same happens for the treatment. Management again is a teamwork of the family, the pediatrician, if required, a psychologist, and the adolescent. So, management classically remains psychoeducation and cognitive behavioral therapy, but it again depend on how severe is the gaming. So, psychoeducation about the gaming of the adolescent and parent. Cognitive behavior therapy does wonders. It's a first line treatment. How it works, it helps the teen to identify the triggers, also help to challenge the distorted thoughts, and also develop healthy coping skills. Family based intervention and parental guidance is needed because it helps in improving the communication, decreasing the conflicts which are there at home, and also setting a good healthy digital habit. So structured goal digital plan we have already discussed, restoring healthy routines like sleep, exercise, outdoor activity we discussed, but most importantly addressing the psychosocial issues, because gaming many times is just a symptom, and it can be from something the teen is escaping from, like stress, loneliness, bullying, or family conflict. So these things must be addressed in counseling, and screening and treating the psychiatric comorbidity remains the mainstay when it comes to moderate to severe gaming, because usually these kind of presentations are associated with psychiatric disorders like ADHD, anxiety, learning disability, ASD, or depression. So we need to screen them first, and whenever we see positives here, then we need to refer them to a mental health specialist. Next, please. So when it comes to medications are not approved as such specifically for gaming disorder, but definitely when there is associated psychiatric disorder, they are needed. Why? Because when the child is having severe emotional dysregulation, then it will prevent that child to participate actively in our CBT. So persistent functional impairment, despite our psychosocial interventions, then is a signal to add medications, but only under supervision of child and adolescent psychiatrists. So which are the medications which are being used for this? In ADHD cases, methylphenidate, atomoxetine. Then in depression, bupropion has been studied a lot with gaming disorder, and anxiety cases, SSRI has been used. But it is important that it is a symptom. We need to treat the ecosystem. The ecosystem involves the family, the home environment, the digital rules. So it all is a teamwork when we address gaming.
Yeah, so perfectly said. So whenever it is severe and associated comorbidities, these drugs can be useful. Now moving forward, this 11-year-old boy who was actually playing games was also watching porn every night and was having some perception about the sexual activities, was addicted to the pawns, also feeling guilt, shame, and secrecy. And because of that, he was remaining isolated, no outdoor activities, poor sleep, and avoids friends and family. Parents have observed that he is watching porn also. So my next question will be, does gaming increases the pornography addiction? And if yes, how does porn affect the adolescent brain? Kalyani, please continue.
Yes, so gaming and porn both are having this shared reward pathway. As we already discussed, they are dopamine driven. They are offering novelty. They are offering instant gratification, constant stimulation. So, is it that this gaming will directly lead to pornography? No, but yes, indirectly, it is definitely going to increase the exposure of pornography for the child who is gaming unsupervised, prolonged, and how this is going happening is there because of this longer online exposure. There are greater chances that the child is going to encounter explicit content. Also, this gaming ecosystem
Just 1 minute,
classically.
Kalyani. Dr. Shamik, Dr. Hello? Hello?
Yes.
Yes, Prasanth.
Recording stopped. The message.
Yeah.
Live streaming is going on, don't worry.
Okay,
That's why
fine.
it is stopped.
Sure. Continue,
Okay.
please, Kalyani.
So gaming ecosystem, which consists of these Discord, then gaming chats, these live streams, they are flooded with these kind of pornography links which can come on your child's screen. Also, when your child is playing adult game, the gaming content which is promoted by algorithm also content mature explicit recommendations. The gaming sites will have this content for adults, but because the child is already playing adult game, the child get exposed to this. And as we all already discussed, that there always is a shared vulnerability when the child is already having a disease like anxiety, depression, ADHD, and having a really poor impulse control. So this is how a unsupervised digital ecosystem is definitely going to expose the child who is gaming to pornography. And not only pornography, cyberbullying, online grooming, these then online frauds, these all can be a risk factor for a child who is gaming a lot. Next slide, please. And let's understand how this pornography is affecting the brain. As we all know, the brain is immature, prefrontal cortex not well developed, and this repeated dopamine reward pathway which is stimulated, this results in tolerance and a compulsive use. And because of the immaturity of this executive functioning, the prefrontal cortex is unable to control this impulse. Also, there is problem with the sexual development of the child who is getting exposed very early to this content, resulting in unrealistic views about sex, relationships, intimacy, consent, body image, sexual behavior. They take it as a sexual education, which is not right. It can influence their behaviors in form of early experimentations, permissive sexual attitudes, emotional and behavior. It can make them stress, lonely. There can be feelings of guilt, shame. It can lead to anxiety, depression, affect sleep. There is another concept which is trauma informed perspective. Sometimes when very younger kids are exposed to pornography, these brain cannot process this content and they can go into a trigger of trauma like response, and this definitely can affect their future. So pornography is not just affecting brain, it is affecting brain, it is affecting emotion, relationships today and in future also.
Yeah, so thank you. And when we are having a gaming and pornography, at that time, we all know that a curiosity about the sexual things and addiction can be there. So, Dr. Jatin, can you just say what is the difference between the sexual curiosity versus the addiction?
Yeah, yes. Well, whether we like it or not, every adolescent will have the curiosity for exploring sexual contents. So it is a normal development, but it should not cross the limit. So we should understand that it's a normal curiosity where, occasional viewing is allowed, but it should not be frequent and repetitive use. It can be triggered by curiosity, whereas here it is driven by urges and cravings. It can stop easily with a normal curiosity, but here it is repeated unsuccessful attempts to stop, and the teenager will also understand that he is not able to come out of it. It will not interfere with daily life in a normal case, but here, those who are with a problematic pornographic use, it will interfere with school, sleep, relationships, and hobbies. There won't be any significant guilt or distress in a normal child, but here, with a problematic pornographic use, there is a persistent guilt, secrecy, or emotional distress. A normal teenager will be able to maintain normal interest in routine things in routine ecosystem, whereas here it will lose his interest in offline activities. So, there is a remarkable difference actually between curiosity versus problematic pornographic use.
Yeah. So perfectly said. As we say, the curiosity is normal thing, but if it turns into addiction and then there is a repeated unsuccessful attempts to reduce it or there are harms to it, then that is a problem. So Ajay sir, actually parents when come to know about the pornography watching, then they say something which harms the adolescents. And there should be certain way in which the parent should talk to the adolescent. So can you just say what to say and what not to say?
Well, we all have experienced that, when parents come to know about the child watching pornography, they are in real shock, and they have to take courage to come to us and to share with us that, their child is doing this. But at the same time, parents should be really careful, because what they are going to comment will make the bridge or will burn the bridge with the child. So it is a good idea that they should avoid statements like "you are disgusting," "you are addicted," "only bad children watch this," "you have ruined your future," "God will punish you," or "will never trust you again," or "boys will be boys," or "girls don't do this," or "if you do this again, we'll take away everything you own. Instead, the parents should say that I'm glad we can talk about this. And many teenagers become curious about sexual content. So let us discuss what you have seen and how it made you feel. And they also should tell that internet does not always portray healthy or realistic relationships. If you are finding it hard to control, we'll work on it together. You won't be punished for being honest. So ultimately, the communication bridge has to be kept on, and parents should understand that curiosity needs education, not punishment, and compulsion needs assessment, support, and treatment, and not shame.
Yeah, so perfectly said, sir. And when we say these things, then usually we say that somebody has asked in a chat that what is the legal age. So legal age is definitely 18, because below 18, watching porn and showing porn to a child will be considered under a POCSO Act. And there are so many risks. If we just summarize into the few lines, then the psychological distress of a porn watching will lead to a anxiety, guilt, and a shame in the young adults. There will be a relationship difficulties, because watching porn will lead to an unrealistic portrayal of an intimacy which affects the real life bonding. I remember MKC sir saying that erotica is good, porn is bad. Addiction and dependency which will be there, which leads to problems, other self-image issues. Teens may have body dissatisfaction, a performance pressure which can be problematic. Even the violence or disrespect seen in the porn will be a problematic. The unrealistic size of the genitals and breast will be a problematic. There will be academic decline. They will be having a numbed empathy because of the overexposure, and a twisted understanding of the sexuality will be a problematic. So in these cases, we must take care that there are certain settings which should be done in our computer so that the adolescent cannot watch porn. So Dr. Ajay Kumar sir, can you just tell us what are the settings for the child safety for so that they cannot watch porn?
Uh, Apart from the counselings and sessions with the parents, which you have just now discussed, Dr. Kalyani Madam has said, there are some things which, as a CMIC chapter, we have been teaching our members how to do the security features or the safety features, child safety features. So in the computers, you can go do some settings, which I hope we will be able to do some demo at least for the members who are participating today. And we can have a separate child account with the safety features like we do it on our television. And we have a safe search mechanism. We can turn it on when we do these settings. And a family-friendly DNS filtering also is available. Browser control, in the browser, there is a child control and pornographic controls are there. A router level protection is there. And then optional parental control apps are also available. And parents should use this screen cautiously and probably have a knowledge what a child is observing in a safe, secure, smart way rather than in a punishment way.
Yeah, so
Dr.
perfectly said,
Prasad,
sir.
if you
I
can
just say that one thing
demonstrate
that
a
whenever
one setting, I think that will be helpful if you have time.
Sir, actually, we are just running short, but then we have just prepared a slide which we will be sharing with them, because today
Go
it's
ahead.
already
Yeah,
25
this is
minutes.
what I was telling
Yeah,
you, the family-friendly DNS.
yeah, yeah.
Yeah.
Yes, sir. Please, sir.
Yeah, it's clearly there as a slide. We will share with the participants this particular thing, and we should learn it and do it practically ourselves by opening the settings in the window buttons and go to the network and choose the connection. Either you're in Wi-Fi or Ethernet, and then edit the DNS system and change the mode to server assignment, change from automatic to manual, enable the IPv, and then go to add family DNSs. So you should do this particular seventh step by adding the family DNS and save these settings. So once you restart, the settings get permanent there, at least enabled, and check if it works and open the blocked adult test category and website. It should be blocked by the DNS filter. So your family is now protected and the family friendly DNS filtering is there. So why use this family DNS? It blocks the obviously the adult content, which is not good for the below 18 years or the pre-teens, teens also. Protect kids from harmful sites, easy to set up, free and privacy focused. So this education to the parents is very important and they should practice it.
Yeah. And sir, this also open DNS.
Yeah, this is another method. Method number 2, what we have given is you can have an open DNS where the family shield is there. And this can be there also in the Windows button and the starting point. You just click it. So you get a network setting and select the connection what you are using, edit it into edit mode and click the edit mode and change the mode to either manual. And from there you go to IPv enable setting and enter the open DNS family shield by preferred DNS. So click it as a save and restart the browser. So through the browser also you can do apart from the filtration coming in from the router. And this enables the access which we have done denied to the adult sites. And the parents reminder is DNS filtering help block harmful websites but works best with open conversation, healthy screening rules, age appropriate supervision. So remember that children are more smart and savvy than us. Whatever you do, they will break it and then open it. So what works is what we have just now talked to them as is open conversation, healthy screening rules, and an interaction between the family and no conflicts and shaming the child.
Yeah, perfectly said, sir. And that's why we say when you are checking your child's account, at that time you should keep your account also open. And by checking the history, if it is for seconds, it is usually due to a pop-ups and not due to addiction. But if it is for the minutes or hours together daily, then that can be a addiction. So when is the referral indicated, Dr. Cmic?
Okay, I think so. We have already elucidated what all can happen because as a consequence of the addiction. And just to summarize, anything that is defined under an addiction, that is, it is compulsive, it is interfering with school, with sleep, with family life, or friendships, or daily functioning. If we get a child who is in such an advanced stage of addiction, it may not be worthwhile to hold on to this child, but give him the best support of a mental health professional. While we might have the gaming and pornography as the presenting features, it is very, very important to look at comorbidities because all of this may be triggered by anxiety, by depression, and it may have severe subtexts in the form of self-harm, suicidal thoughts, aggression, severe social health withdrawal. Out of these, especially if you detect that there are any suicidal thoughts, an urgent referral to a psychiatrist is a medico-legal responsibility. We must also be looking for coexisting problems like an undiagnosed ADHD. There could be substance use disorders. There could be significant family conflict or a post-traumatic stress disorder in this child. So basically, while the presenting feature may be gaming or porn addiction, please don't turn a blind eye to associated comorbidities. And especially when you have multiple comorbidities, it is best to seek the help of a mental health professional.
Yeah, perfectly said. So now a quick rapid fires, like this is just a case of a selfie in which a 14-year-old...
Sorry to interrupt, Prashant. We have 5 minutes remaining.
Yeah, that's what we are doing. A quick rapid fire. A 14-year-old girl who shared an intimate image with boyfriend, a relationship breaks, picture circulates in a school and now refuse to go to a school, having a self-harm thoughts and parents want police section. So quickly, sir, what is the difference between sexting and image-based abuse?
The sexting is between two mutually consensual adults, maybe a girlfriend and two friends. And whereas a image-based abuse is sharing, threatening, and spreading someone's intimate images without permission is definitely alarming and an abuse, and it's a violation. And if there is any privacy, trust without consent, sending it or threatening or blackmailing, which we have seen in one of the BBC series Adolescent. That's where even the crimes happen when the murder of the girl happens. And this is what is bullying. Cyberbullying is what we think is mainly leads to if it is image based, and sexting is prevention. Think before you share. That is what we should tell them. Pause, think, and take time and protect yourself rather than sharing your images with anybody, even if it is a close friend.
Perfect, sir. So, Jatin sir, what is the role of cyber cell in Quick for preventing
Well,
this?
we must understand that for all technology facilitated offenses, we must approach cyber crime cells, because they will help us in digital evidence preservation in form of a screenshot, chat, email records, username, URL, payment details, phone numbers. They also will be able to help us identifying offenders by tracking their IP addresses, device identifiers, email accounts, fake profiles, social media accounts. They will also help us blocking further spread by removing explicit image, suspending fake accounts, block impersonation accounts, preserve evidence before deletion. They will also help in investigating financial extortion, and they can coordinate with other law enforcement in form of a local police or in form of a child protection authorities or in form of a digital forensic expert and whatnot. Now, cyber safety tips, in antibiotic, we used to tell that you think before you ink. Now, it is you think before you share. And we must tell to all the adolescents that never ever share intimate images to anybody, including to your beloved, because you never know what will happen later on. So never ever share intimate images. You must verify identities because not everyone online is who they claim to be. And video calls and profiles can be manipulated or entirely fabricated. They should be told that they should protect privacy. They should use private accounts. They should turn off location sharing. They should avoid sharing school names or college name, addresses, or daily routine publicly. They should use strong password and two-factor authentication. And they should report early, because if something feels wrong, they should stop responding. They should tell a trusted adult. They should report the account to the platform and seek help immediately. So, friends, if someone threatens you with an intimate image, don't try to solve it alone. Tell a trusted adult immediately. You won't get into trouble for asking for help.
Perfectly, sir. And when this type of things are happening, usually the girls who make a online friend, meet someone on Instagram and receive some gifts, may start video calls, ask to keep relation secret, but then later blackmail. So, Kalyani, in a quick, can you just say what is the process of grooming and what are the red flags of online grooming?
So grooming usually doesn't begin with abuse. Begins with affection. Begins with contacts and emotional validation. They will classically identify vulnerable kids who are lonely or they are emotionally distressed or unsupervised, and they will compliment. They will have share interests. They will frequently message them. They will provide emotional support. And then after that they start isolating them. They encourage secrecy and ask the child to distance from parents and friend, and gradually they will introduce sexual topics, request for personal photos, and then they will test boundaries. So this happens very gradually, and the end stage is the exploitation, where once you share the image or videos, they will blackmail, and they will even ask for an offline meeting. So awareness of these all stages is very important, and teaching our teens in advance that this can happen to them whenever they are interacting with a stranger online. So red flags, what are they? That what as a parent we should know ki our child is hiding something. There will be sudden secretive behavior with the phone's laptop. They will have a friend who they don't want to discuss with us. They will have they start using platforms which are secretive, a newer platform they never used previously. They can get unexpected gift, they can get money, they can get online gaming credits. Also, there may be an rapid emotional attachment to someone they have met online. So these all will happen to the child, and they will try and hide it from the parent. This will result in increased anxiety, withdrawal. There may be sleep disturbances and decline in the school performances. And these threats and emotional manipulations, this will happen at the end stage of the online grooming. So the strongest red flag for parent is the secrecy. When an online relationship is kept secret, exclusive, and the child is getting emotionally attached to someone, then that is the biggest red flag.
Perfectly said. So as such, we have already covered all this cyber cell helps, which should be there. One thing which should be there is a reporting on 1930 or a cybercrime.gov.in, or simply to a childline 1980. That is most important. Deepa, if you can just give 2-3 more minutes, then just last 2-3 slides are there. Should we finish it?
I think we can go ahead. Yeah, please.
Go ahead, Prashant.
Yeah. So this is just a rapid fire, because in today's era, when we are having this type of cyberbullying, the deepfake cases are increasing. See, these deepfakes are actually a synthetic medias created using the artificial intelligence, in which you just swap the faces, you clone the voices, or you map expression onto others' body. And this is possible in today's AI era. If you see the high stake financial fraud, Arup Engineering, $25.6 million fraud happened, in which a person has impersonated as a CEO of the company. A political disinformation propaganda which happened in current Ukraine and Russia war, in which a fabricated video of a Zelensky was there. This was very much realized by Tom Cruise in a movie's Mission Impossible, in which we were seeing this. And at present, the Ranveer Singh has filed a FIR in which he was being actually been portrayed that he's speaking something political which is not correct. So this type of deepfakes are actually happening, and you have to identify it early. For that, what should be done is, whenever this deepfakes are done, it is AI generated. There will be some clues, like there will be details which will be distorted, the edges will be blurred, there will be a strange skin texture, unnatural face shape will be there, eye and expression error will be there. You can find unusual blinking or a blank stare, or emotions not matching with the speech. There will be ear and edge mismatch. The poor lip sync can be there. A fake lighting and shadows will be there. Audio abnormalities will be there. And you must know the source and then only trust these things. So that is most important. And for this deepfakes, we do have certain things which is a technology again will help in this. First is a reverse search. If you find some image which is, or a video which is already of some reputed person, just put it in a Google image search or a video search. Reverse search will be there. There will be a fact checker websites on which if you upload it, it can tell you if your photo has been morphed and been made into a nude or semi-nude or a sexual category, then you can just upload that into stopncii.org, in which they will actually remove the blueprints within 24 hours. That is there. And nowadays we do have a AI detection and scanners that are also useful, and that should be used. Most important, whenever you receive any image to which you don't trust, you must report it immediately. There are accounts which are being made fake. You have to report it. The any image which is non-consensual, intimate image, child sexual image, AI generated images, harassment images, that should be reported. Again, report to a cyber police. 1930 is very good. Cybercrime.gov.in is there. And most important, we say that you have to preserve the evidence. We do not circulate, we do not delete. That is most important. That is the smart way of dealing with the fakes or the bullies. That stop the messenger to be blocked, the action has to be taken, and most important, never to be retaliated, and tell to a trusted adult. And this slide ends our talk that a safe child is most important message which we want to give. Thank you to Dr. Yatin Mehta. Because of a time, I'm just reading it, that we have to screen every adolescent for the digital habit. We have to assess for cyberbullying, grooming, gaming disorder, and sextortion. We have to foster open, non-judgmental communication. We have to educate families about digital literacy and privacy. We have to counsel on healthy screen use and online relationships and help preserve the evidence. Don't forward harmful content. We have to inform the cyber cell and police when exploitation or threats are suspected and look for the mental health consequences and defend every child's right to a safe digital environment. So together, let's build a safer digital world for every child. And this is the team you were listening to. Thank you so much.
Thank you all. Thank you all for attending this
Thank
session.
you.
Yes.
Thank you so much. Yeah, so
Thank
we
you so
just
much, Prashant, and the phenomenal panel members for such an insightful, practical, case-based breakdown of the digital maze. I would like to quote the comment by Dr. Geeta Bansal. What a nicely structured, useful, and informative session. That itself speaks how impactful it was. And we'll now open the floor to the audience. We have some questions in chat box. Ma'am, can we go ahead?
Deepa, we have
Yes, ma'am.
10 minutes and quickly go through the questions. Samir bhai, you may screen the questions and then shoot. I think so. That will make the job easier. There may be some repetition or something. So we have only 10 minutes
Yeah.
and we can just quickly go through the important questions. Fast.
So
The first question.
May I ask, ma'am?
Yeah, please go ahead.
Yeah, Dr. Avinash Bansal has asked, with smart classes becoming a norm these days, homework being on WhatsApp, what is the way forward?
Cmic.
Yeah, I mean, we did talk about balancing and rationalizing, and what is there for education has to be within the normal screen times. Anything that is excessive, which is going to become compulsive and interfere with the lifestyle, that has to be forsaken.
Perfect.
And he has again asked, what is your take on extra games for children who cannot play outdoor games as a substitute?
So quickly,
Extra games.
there were so many dopamines which were said apart from the physical activities. There are so many other things which can be done. So we have to substitute with that dopamines.
Indoor games are also the better options.
No, I think he's asking about the physically challenged who cannot actually take part into the physical.
That's why indoor
activities.
games. That's what indoor games.
Yeah, indoor games. Perfect. Yeah.
I think
Okay.
extra games are the games which you can, physical games you can play online. So now, Dr. Geeta Bansal has asked, what is the safety profile and for how long it can be used safely? I'm not sure what he's mentioning to. Is it approved for gaming disorder?
Actually, it is in connection to Dr. Avinash Bansal's question.
Yeah.
That is there before her question. So both the questions are together.
Okay, so
Kalyani, bupropion specific
That
for
is
gaming
because of
disorder.
specific for gaming disorder related depression.
It is not specific for gaming disorder. It is used for depression. There is no medication as such specific for gaming disorder. We are screening them for whichever comorbidity is associated and we are treating accordingly. If it is associated with depression, then psychiatrists will plan according the treatment of management of depression. If it is associated with anxiety, then anxiety related medication, and ADHD also very common with gaming disorder, then ADHD related medication. So this is not a medication for gaming disorder as such, for comorbidity.
Sometimes it is, yeah. Sometimes I think it is used off-label for the depression associated with substance use disorder.
Yes.
And sometimes, as a comorbidity, ADHD is there. But both of them, they are actually not promoted ethically for
gaming
the
disorder.
adolescents.
Yeah.
So they should not be used ideally.
And Dr. Lal has asked, can we tell adolescents about POXO leading to punishment if they see porn?
Deepa, nicely answered by Dr. Pankaj that we want connection. We don't want to make them fear. So it is open communication and supporting trust will be a better thing. And the thing is, when they tell you, you have to trust it. The reason why I'm saying is, I've written that in my book also, in which My son has actually said me, I'm using MacBook at present. He is also using a MacBook. He said, Papa, ये देखो ना कौन से pop-ups आ रहे हैं. And I saw it was a porn pop-ups. So the first question came to my mind was, बेटा बड़ा हो गया अभी वो porn देखने लगा. ऐसा पहला impression था. But then, as I said, when I watched the history, it was literally a pop-ups. It
Yes.
was for less than few seconds. It was there. The reason why that pop-up came, all students who are preparing for the 10th, 11th, 12th are using two platforms, Discord and Telegram. Discord for the online games and Telegram for downloading unethical things. I mean, the educational material only, but to get it free. And they do have porn pop-ups frequently. So you have to see, and Ajay Kumar sir, you can say more about this because they are going to a dark web to get all these things, and that can be a reason for these things. Yeah.
Yeah. Pop-ups are so common. Even when my son was doing something on the online work in the computer, 25 years, 22, 25 years back. See, at that time, pop-ups were coming. So pop-ups are there, and we should not be touching that or ask the child, I think, preemptively not to click on that or do anything. So that will lead to other things.
Yeah, so pop-ups actually, the Blue Whale and the Momo, those games were actually coming as pop-ups. And then the adolescents were trapped into it. So it's very common, as Dr. Rajoy sir very rightly pointed out.
Dr. Amrita Durga has asked, are we as adolescent pediatricians able to prescribe psychiatric medicine?
There are a number of drugs which we can prescribe, but there is another session on it, and we will not. It's, I think, out of the scope for this webinar.
I think these are the questions we have. Over to Dr. Prema for further proceedings.
So before that, thank you so much to my panelists and thank you to AH and CMIC office bearers for giving us the opportunity. And I hope we were able to justify in this short time. Yeah, thank you.
Prashant, if possible, we will leave that locking system and the madam can distribute all
Absolutely, absolutely. And one more thing, I would like to declare for all the the audience, the Interchapter webinar series, we are going to upload the presentations and the information related to that on our website. So don't you worry, you'll be getting it as a resource material whenever you can, you want to explore, you can always, right? So I think that will be a good, I think it will be a good way to visit our website also, which is so painstakingly made. I think this is
YouTube automatically records, no, madam. So if
yes,
YouTube
yes,
is there, that
100%.
link.
Yeah.
We
you.
are
It was a
uploading
really
all the
wonderful.
recording over there, sir.
Yeah.
Yes.
So
Dr.
recording
Subodh
us.
Gupta, raise a hand.
Yes,
Dr.
Subodh
Subodh
sir.
Gupta wants to say something.
Yes, sir. Sir, from this very innovative talk, it is clear that there is a thin demarcation between the healthy and unhealthy content, gaming and porno, and similarly safe time and unsafe time. Moreover, this vicious circle of dopamine does exist. So, under these conditions, what other countries they have done, this should be banned below 16 or 18 years of age. This was my personal
Australia
opinion.
has already done. I think two more countries or four more countries have done. So in India, I don't know how much we can implement this banning. That's
I think in
right, sir.
Karnataka,
That's
I think in Karnataka, the talk is already going on.
Yeah.
Deepa can highlight. I mean,
They have
Dr.
already,
Prema, he
ma'am.
belongs to Karnataka.
I think
Yes.
they have
those
already.
things.
They've
Yeah.
already
already
So they
banned.
have banned it, and so that's a welcome step. And let us see what can happen next.
because it is very difficult to control the children. Though we can in the webinar say this much is sufficient control, but once they get addicted, it is very, very difficult. They even go on to the term of abusing the parents.
Yeah, thank you, sir, for pitching
Dr.
in.
Gupta,
And
I
I
would
would
go a step ahead. Adults are addicted. So,
yes, of course.
as we
I
said,
would
250
yeah,
role
sir.
models for
Thank
them.
you. Thank you, sir, for an excellent webinar
Thank you.
and very, very informative. And my heartfelt thanks to all the speakers and the panelists. And it was just excellent and got much beyond imagination. We could learn a lot. and very informative. Dr. Cmic Shah, as usual, Dr. Ajay Kumar sir, Prashant has created that panel very, it was very well drafted panel, and I think you could explore many areas, case-based discussion. Dr. Shamik, Dr. Yatin Bhai, we had a lot to learn from you, and we still continue to learn from you. Dr. Kalyani, as expectation, she had done a fantastic job, and my heartfelt gratitude to all of you. And I think let us have a final word from our Dr. Deepak Gautam sir. So, sir, please.
As rightly said by Madam, an excellent and very innovative, very informative informations, very excellent panel discussions by Dr. Prashant. As usual, there's nothing new, and a perfect talk by Dr. Samir. And I really thankful to the office bearers of medical informative computer CMIC chapter, and the last but not the least, Dr. Sushma Desai, for bringing this idea of inter-specialty chapter webinars and making it tirelessly with different nicely. Thank you very much, and thank you all the members of IAP, fellow pediatricians who all attended today's webinar. Thank you so much. Thank you so much,
Before
everybody.
we end,
Thank you.
Dr.
Thank you,
Deepak ji,
ma'am.
for all those words, and look forward to having all of you. Before we end, I would like to extend my heartfelt gratitude to 2 stars. I mean, who could conduct this program so fantastically, Dr. Prema and Dr. Deepa. And we are very much thankful to you for meticulously conducting the webinar. Thank you, Dr. Deepa and Dr. Prema.
Thank you, Madam, for giving the opportunity.
Thank
And
you.
thank
Good night.
Alice.
Good
And
night.
don't miss
Dr.
to
Shamik.
register
Good night.
for our upcoming session on the life skill education on orientation course between the 22nd to 29th.
In collaboration with us. Thank you, Samir Bhai, for that announcement. And once again, good night, Shubhratri. And Banga sir, thank you so much for joining in pair. Thank you, Geeta ji, for joining, and all Dr. Subodh Gupta sir for pitching it, for
Thank you.
those
Thank you,
comments and everything. Yeah, thank you so much.